What are some of the signs of cataract development in your
Yeah.
eye? No pun intended, but what should
What
I
should
be
we look
looking? What should I be looking for?
Yeah.
You just notice that there's something happening with your vision. You might blink your eyes trying to clear it and it doesn't clear. The cataracts is a visual problem. It's how you see. So if you notice that, you're getting a graying out, the contrast doesn't look as good, it looks hazy. It could be any of those things, and somebody just doesn't see well. In today's world, you have to know that cataracts are progressive. Once you start actually getting a cataract, it's going to progress.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Do you know a lot of people who have had cataracts?
Do I know a lot of people who have had cataracts? Yes, but that's only because my mom's professional background before she became an attorney, she worked as a social worker for people who are blind and visually impaired. So yes, I do know a lot of people who have had cataracts.
Wow.
But it's not just for people who are blind and visually impaired.
No.
I mean, cataracts are a lot more common than people
Very
think,
common.
right?
My mom's having cataract surgery next month.
Really?
Yes. Yeah. I know. It's very common, like you said. But the funny thing is, even though it's so common, I really don't know a lot about it. Like I've
Nor
asked
do
my
I.
mom some things, but
I know. Yeah.
I'm curious what
I'm curious too. And I feel like as we get older, because when we're younger, we're like, oh, that's never going to happen. I'm not going to have to worry about that as long as I get my regular eye exams. But it's not about that, right? And I want to be more well informed now so that later on, if I need cataract surgery, I'll know what to look for.
Yeah, and we won't be afraid of it or any
Yeah.
like I also have someone very close to me, my dad, who is quite a bit nervous about things like this, you
And
know?
you can understand why. I mean, when you hear the word cataract, your first thought is, uh-oh, right?
Yes.
And
surgery.
and surgery
Yeah.
because it's not like it's something you can fix by like, going and picking up something at the drugstore,
Yes.
right?
Yeah.
Yeah, and that can be scary. But let's make it less scary for the people who are listening and watching our podcast right now.
Yeah, and the people we love.
Yeah, and we have a great expert today. Her name is Dr. Sheri Rowen.
Mhm.
She trained at the University of Maryland Medical School and Johns Hopkins Hospital.
Yes, she formed the Department of Ophthalmology at Mercy Medical Center in Baltimore.
Formed the
She
department.
formed it.
That's
Yeah.
not a big
big
deal.
deal.
Yeah. And Dr. Rowen has pioneered new treatments and techniques for cataract surgery that has included demonstrations through live surgery in France, Italy, Sweden, Brazil, and Australia. Live surgery?
I mean, she sounds incredible. She
Wow.
serves as the medical director at Envision Eye Centers and is certified by the American Board of Ophthalmology.
So what it sounds like is Dr. Rowen knows her stuff.
Just knows a little bit.
Just a little bit.
Yeah.
And she teaches other people about it too.
mean,
So now she's going to teach
She's
us.
the expert.
There you go. So
Yes.
let's bring in Dr. Sheri Rowen.
Let's do it. Hello, Dr. Rowen.
Dr. Rowen
Thank
in
you
the
for being
house.
here, Dr.
Yes, I
Rowen.
am.
You have been an ophthalmologist for almost 40 years.
Yes.
That is incredible.
It's your tell us a little bit about your history and why you decided to focus on the eyes.
Yes. Good
Well,
question.
it's an interesting, probably too long to go into.
Oh,
but-
we want to hear
We
it.
want to hear it.
We want to
You
hear,
wanna
everything.
hear the whole thing?
Yes.
So we're not limited in time.
No, we are not.
We got
You go
24
for it.
hours.
Deep dive.
I mean, I didn't even know I wanted to be a doctor till I
Really?
went to
Why?
college.
Okay, so tell us how
Well,
that
I
changed.
took a course and I just realized that science was incredible. I was more of a creative. I was going to go into psychology. I was going to get a PhD in psychology.
I can see it, actually.
I was
what
actually
changed?
accepted into it. I decided that I wanted to change and help people in their lives in a different way.
Oh.
And so when I did surgery, I realized that I had to be a surgeon. So we train in different specialties throughout medical school.
Right.
And it was only then that I realized I was originally going to be a pediatrician in medical school. Then I went to internist. And then when it was surgery, it was done. I had to be a surgeon. And then I had to pick which field would work. And I happened to check out eyes, and it was the most beautiful thing I'd ever seen. So when you see an eye under our microscopes,
Right?
it's beautiful and it's clean and it's elegant and it's fascinating. And we never, in fact, the story, I even said it today because I was talking with somebody about new technology. I consult on a lot of new technologies and help
Okay.
companies with startups. And I said, are these two little things going to entertain me for the rest of my life? I can't even keep up. The research and the
amazing?
science, it's the most complex organ in the body to me.
To give our audience a little bit of background on you also, because I know you're not going to sit here and brag about all of it. You're the medical director at InVision Eye Centers. That's right. Okay. You trained at the University of Maryland Medical School and Johns Hopkins Hospital. You formed the Department of Ophthalmology at Mercy Medical Center in Baltimore, and you served as clinical assistant professor at University of Maryland. Wait, when did you have time to have fun, though? That's the question. That's the question.
What does
That is
the
a
word
very good
fun
question.
mean?
What does
I
it
don't
mean?
even
What does
know.
that mean?
Fun has not been the operative word as you move forward in your career, but I always try to. You know, when we go to meetings, we always add on maybe if we can a day or two to do something fun. And I've always loved fun. I've golfed. I've danced salsa. I've
Oh,
put
wow.
all these things into my life throughout my growing up
Well, it
and
sounds
made it
like
fun. So I try to.
fun in your career
Right.
too. I mean, you've
Well,
discovered
my career is phenomenal.
you've pioneered different technologies. It
Yeah.
sounds like, and you're teaching people these technologies. And
Yeah, when I was young, I had the opportunity to be. I was sent around the world to teach new cataract techniques in France, in Spain, Australia, Brazil, Sweden, and Italy.
I mean,
And
that
I
sounds
brought
fun.
those first techniques there and showed doctors how to do them.
That's amazing.
You mentioned cataracts. We've heard that term before, but I don't think the majority of the public really even knows what a cataract is. Will you explain what a cataract is,
Sure.
please?
People think it's some film over their eye, but what a cataract is you have a lens in the eye, no different than a camera. So everybody knows there's a lens in a camera, correct? We have a lens in our eye that focuses in a miraculous way. It's clear, it's encapsulated, it's got little ligaments all around it, and every time you look here, it focuses close. If you look far, it relaxes. And so it moves all the way through our lives up until we're in our late 40s. In our late 40s, it starts getting a little firmer. It was very gelatinous and soft, and we can feel the difference as we remove them. 40s, 50s, 60s starts getting firmer and harder, and sometimes that lens becomes like a little marble in the eye.
Ooh.
So even before it becomes a marble, it could get cloudy, it could become whitish, yellowish, and opacified. So it can get hard or cloudy, and then it doesn't focus well. So light has to come in and bend perfectly through that lens to get onto the back of our eye, which is called the retina.
Okay.
Okay.
And that's how we see clearly.
That's how we see clearly. So once the cataract develops into a cloudy substance, it gets blurry, we get glare, halos, can't see our
Can't
street
focus.
signs, can't focus. In the late 40s, it starts becoming what we call dysfunctional, the lens, and that's when you start needing the reading glasses.
Oh, I always wondered
that's
what
why.
prompted that. So it's really a natural progression, like a natural aging part of the aging process.
100% of the
I did not know
population.
100%
Wait,
will need
what?
bifocals?
Everybody.
Everybody?
Everybody.
Oh my gosh.
I did not know that. Better
so
get ready for
sad.
my readers. Better get ready for my
I was
readers.
going to be immune to it.
I
You're not.
know.
Even with, oh my goodness.
No, we'll talk about it because you told me you had LASIK.
Yes,
so
I had LASIK.
LASIK corrects your distance.
Okay.
But
they've
the
done
lens still continues to change.
Darn it. I thought I was immune.
Yeah. So late 40s, early 50s.
Okay, it's
people
coming for
start
us soon.
people start moving their reading material further out until
Yeah.
they need a +1 reader, a +1 and a quarter, or
Oh.
whatever. And sometimes we do a lot of different magical things to help that.
Like
We have
what?
new drops coming out actually.
What?
Yeah, there'll be a drop that will bring the pupil down. That's another way you can bend light a little bit
Okay.
differently. That's coming out sometime this year. So it's called QLOSI. That
Okay.
might be a good one. We'll see for certain
Prescription
people.
only for that?
That would be a prescription.
Not an
through
over
the
the
And it's like
counter kind of
doctor.
thing.
No.
a drop that helps with bifocal, like to focus.
Well, it will help people to focus a little. It brings your
Okay.
pupil size down.
Okay.
Okay. Okay.
Wow.
So if you had really bright blue eyes, it might look a little funny, but if you have brown or green, it might not look too bad. You know, you wouldn't see it on yours, for instance, but it will help sharpen the image.
That's so
So that's
cool.
one way. And then there's other surgeries that we do for that, but that's called presbyopia.
Okay.
So presbyopia is the beginning of the dysfunctional lens as it ages on to become a cataract.
Okay. So that's not quite a cataract yet. Like being,
It's not
a
quite
got it.
It
cataract.
has to progress to that point.
It
to be a
progresses.
cataract.
Okay,
Okay.
understood.
We call that dysfunctional lens syndrome, where it starts in the 40s and
Right.
50s, and then it starts getting cloudier and yellow. And it's crazy because when you take a cataract out, people go, "My God, the colors! The colors change."
Oh my goodness.
If you watched Claude Monet's progression with his beautiful blues and all the things he painted, as he got cataracts, his colors became brown.
No.
Oh,
on
now I'm
his
gonna have to
painting.
look
I
at his
know.
paintings.
Yeah, we'll see
Yeah.
his paintings in
Well,
a
in
And I don't
order.
even know
Yeah,
if
so,
you
like-
can see it. I mean, I saw it and when we were learning about how it affects the vision. So it changes the color, the brightness, the clarity. You can't see things. You can't see so we take. So what we do is we have technology through very tiny little incisions. Nobody feels it. They're awake while I'm doing it. But
Oh my
there's
goodness.
but hang tight, hang tight. You're sedated with a little
Okay.
IV. We call it conscious sedation.
Oh,
But I
yes.
can talk to you and tell you to look at the light.
Which is similar to LASIK, as I experienced.
Very similar to
Yes.
that.
Okay.
It's very fast. Most people at the end of it go, "Did you even start?"
Are you done? Really?
Yeah, they
How
don't.
long when you say it's very
It's
fast?
about 10 to
ballpark?
15 minutes, max.
That fast?
Yeah.
I
that
feel
fast.
like I remember LASIK being the same, that fast, right?
Yeah, LASIK
Okay.
is very similar.
And I remember thinking, wait, there's no way this worked.
Right. So for the viewers, if we'll go back to LASIK for a moment,
Yes.
since we're talking about vision correction. LASIK is a procedure that's done on the surface, the outside surface of the cornea.
Okay.
We don't enter inside the eye.
Oh, wow.
But
For LASIK.
cataracts-
I didn't even know.
For cataract surgery.
You're
Yeah,
entering.
we'll go from LASIK to, so LASIK, you have to have a certain prescription, a certain amount that we're allowed to do that's
Yeah.
safe. And we just make a little flap in the cornea, do the laser, and put the flap down, and people see, as you saw, the next day they're perfect.
Yeah.
And everybody I know who has it, and everybody I've done has said it's the,
The
best,
thing I've ever done. It's the best
The
thing.
best thing.
While we're
ever
talking
done.
about LASIK, though, before we move on, so I wear contact lenses, right?
Okay.
And I wear disposable daily contact lenses.
Right.
And I'm -6 in both
Okay,
of my
so then you're the
eyes.
perfect person. I'm going to talk about the next technology.
Oh, but I've always been
Oh.
told I'm not a candidate
Oh,
for
really?
LASIK. I'm not an ideal candidate for LASIK, even though I have leveled off.
Yeah.
I've been a -6 in both eyes for, I guess, 2 or 3 years now, but I have astigmatism.
Well, if you remember, I said there's a certain number of the population that's not a candidate for LASIK.
Okay.
Either your cornea is too thin or you have too much astigmatism. I can now treat -16, -20 with 4 diopters of astigmatism with an ICL.
What is that?
So an ICL is an implantable. It's like an implantable contact lens. That was the
Oh,
original
ICL.
ICL,
Okay.
but Collamer is the material. So it's implantable Collamer lens, and we call it the EVO, EVO.
Mm-hmm.
Okay.
And it's interesting because they have a lot of celebrities talking about it, and a lot of athletes who have picked it because it doesn't get affected like the flap might if you poke your eye.
Okay.
So it's a again 5 to 10 minute procedure.
Oh my goodness.
A tiny little incision on the side, and you don't feel anything. And we just slip the perfect lens in right behind your brown part of your eye, in front of your natural lens. You don't lose anything. It's additive. You don't take any of the cornea off, and you have instantly perfect vision.
That's amazing.
Can I get on your books?
Yeah.
Is that like, can I have your card, please? Because I'm not even kidding. I'm not
No,
even
seriously,
kidding.
it will change your
incredible.
life.
And you
It's
were-
life changing.
It sounds that way.
Yeah.
I really need this.
It sounds that way. But I want to go back to cataracts for just a second. I know we were talking about LASIK, we were talking about ICL and all that.
ICL.
But when we're talking about cataracts, and I know you said it's a part of the aging process, but is there a way to slow it down? Is
I
there
We were
intervention?
hoping one of the new agents that we were hoping for didn't pan out in bigger trials, but
Hmm.
if I would say anything about slowing it down, wear sunglasses with UV protection.
Really? Okay,
Of
so it's
So
course.
that's a big one.
Okay.
And that also protects the outside surface of the eye because we see a lot of unusual growths on the outside of the eye from sun damage,
Oh, wow.
like pterygium and pinguicula. We have some names for all these things, but they grow, it's abnormal growth.
Right.
So, sunglasses, eating a good diet with antioxidants,
Hmm.
and
Interesting.
really our nutrition is a big deal for everything in our body. So, I advise people if somebody said to me, what should I do? Well, don't eat a lot of processed foods.
Hmm.
Don't eat foods that are bad for you. Our American diet is really not so great for us, the way when you look in other countries, we have easy access, easy ready food. You pull it off the shelves. And when you go to another country, you get fresh vegetables, fresh fruit, and you
Yeah.
prepare your food and you don't eat a lot. So
Right.
there's a lot of things we do differently in the United States. That's probably the best thing I could say, but there's still hereditary influences. I have a 36-year-old that just came in with bad cataracts. We've seen people born with cataracts. So babies
Wow.
can be born with them. You can get them in your early years.
Oh,
You can get them in your early teens. You can get them all the way through life. We have books on all the
wow.
formations of cataract.
How do you diagnose cataracts?
I was
Excuse
going
me.
to ask that, and I was also going to ask: are there times when people get multiple diagnoses over time? Like if they have to have
Comes
multiple?
back, you
Yes,
mean?
thank
Well,
you
you
for
don't
Oh.
that.
get another once the lens is removed, it doesn't come back.
Okay.
Okay.
Now they talk about a secondary cataract when that just means there's an encasement of the lens. It's called a capsule. Imagine a grape, and the
Mm.
grape skin around it, and then the inside is the fruit,
Uh huh.
the pulp. We take out the inside and we leave this very thin, clear capsule. That's where we put the new implant, the lens implant in. So we actually take the lens out, leave its little container, and we put a lens in. And then I can talk to you about all kinds of lenses that go in because
Huh.
it's really remarkable. And sometimes that capsule gets a little cloudy. So that's a 5-second laser in the office, and we just open that up real quick.
Oh wow.
So that's the secondary cataract.
Okay, that's probably what I had.
That
Okay.
makes sense.
It's not a real cataract. Now, when you get this procedure, like the ICL, so I'm measuring your eye. We're getting the length of the eye, the shape of the eye, and all and if you have astigmatism. ICL, you just add a lens in. With a cataract, you take the lens out and then you add a lens back
Oh
in,
wow. Okay.
which is very different power, different shape, everything. And it sits there for the rest of the patient's life. We orient that lens to correct the astigmatism. So the astigmatism is an abnormal curvature of the outside of the eye. So you can correct that with LASIK,
Okay.
you can correct that with ICL, and you can correct that with cataract surgery. And some people even come in their 50s and 60s who haven't really developed a full-blown cataract and say, I want vision correction.
Hmm.
Oh.
And then we will also do a lens replacement. It will be just like a cataract surgery, but we call it refractive lens exchange.
Okay.
So we actually just change the lens out. And
What
we
are
can
some
do
of the
this.
signs of cataract development in your
Yeah.
eye?
How
What
do
should
you
we
know?
look? I mean, no pun intended, but what should
should
I
we
be
look
looking? What should I be looking for?
Yeah.
Well, you most likely wouldn't get it at your ages, but
No.
you can get blurred vision. You can get halos around lights at night. You might not be able to see the street signs. Reading might be difficult. You might not see the numbers on the TV. You just notice that there's something happening with your vision. You might blink your eyes trying to clear it and it doesn't clear. We'll talk about that in another part too, the blinking
Okay.
of the eyes. But the cataracts is a visual problem.
Hmm.
It's how you see. So if you notice that, you're getting a graying out, the contrast doesn't look as good, it looks hazy, it could be any of those things, and somebody just doesn't see well. In today's world, you have to know that cataracts are progressive. Once you start actually getting a cataract, it's going to progress.
Oh, great.
So
It gets
some
worse.
of the some of the doctors have kept patients and say, well, it's not ready. We don't. So let me correct the misnomer of that.
Okay,
Please.
myth busting.
This is
I love
myth
that.
We love myth
busting.
busting.
Yes,
I
Dr.
love that
Rowan,
here.
The old adage of it's not ripe. It has to be ripe. Okay, they used to wait. They called it when it got ripe when it turned white.
Like when you could actually see it?
You could actually see it.
Wow.
Oh.
White in the pupil, and then they had to take it out in one piece, and they couldn't even put a lens in it. And so, trust me, we don't wait to that.
Okay.
Here's another thing: if you knew that your cataract was turning the color of your pants or the table, right? It turns brown.
brown. Okay.
When it turns brown, it gets hard. Now I'm going in the eye, and I'm sculpting in the eye, and it's hard.
Sound plush.
It's like a little marble or a rock. Cataract means rock,
Oh.
by the way.
Oh, I didn't know that. Okay.
Yeah, it's a
Okay,
Greek word
good
for
to know.
cataracta, which is rock.
Okay.
And so we don't want to wait till it's a rock.
No,
Oh,
of course
that
not.
So we
makes sense to me.
we don't wait for it to be, ripe.
Right.
So
right.
what we do is a lot of the doctors will just keep changing your glasses until, but the vision isn't really necessarily getting better. So I think when you're starting to see when you're older that your glasses keep changing, they're not supposed to change when you're
Okay.
older. So then we know it's the lens
That's a
that's
sign.
changing, and you don't really have to wait as soon as it affects your activities of daily living, which are the things I just talked
Right.
about.
Then you should go.
Driving, reading,
All of these
working, looking on the computer, feeling like you're uncomfortable. I have patients that come in saying, I don't feel safe driving at night.
Oh yeah. What if a person doesn't want to do this? Or I have someone very close to me that I know has cataracts, and he does not want to get it taken care of. What happens?
Well, it gets worse.
Uh-huh.
And
Can they go blind?
Yes.
Oh my gosh.
It's not a
I gotta
permanent
get him to
blind.
listen to this episode.
Yeah, but cataracts are one of the leading causes of blindness in the world.
I believe it. I understand.
Because in the rest of the world, they can't gain access to what we
Right.
have to offer. So a lot of us will go overseas and do mission work and will help. I've done it many times, and we help.
Wow.
Yeah, one week I went to Colombia and I did 100 cataracts that week. And people who came in and couldn't see at all. I went to Guyana, Colombia, I went a number of places. We go to Africa. We've gone to all kinds of places all over the world because they don't have the accessibility that we
Right.
have here. And even if you do one eye, you see somebody who's now seeing their kid for the first time, or their son or daughter or whatever. It's really like babies.
Yes.
Because some people get it earlier in the tropical zones. As I said, no sun protection,
Right.
heredity, diet, all of those things.
What does it mean to you to be able to literally give people back their sight?
Yeah.
It's that when you say, how have you loved your profession, it's the most rewarding thing I could have ever
That's amazing.
thought about doing. I mean, to have somebody come in and go, oh my God, thank you for giving me back my sight, my life.
Sight. Yeah.
Well, you know how it felt. When you wake up every day and you can't see and you have to put contacts on, as you know, before you get out of bed.
Every
Or
day.
you can't even see your clock.
Right.
Well,
You're right. I don't, because of
you
course I
can't-
don't sleep with my contacts in.
No,
No,
you can't.
no, that's
I know.
terrible.
I know.
But you can't function, and if
No.
you should have a fire and you run out and you can't see, I mean,
part.
people
Oh gosh.
are just amazed at what it's like to get their sight back.
It was the most life-giving thing to me. And
Yes.
absolutely. I remember I was a theater actress at the time, and I remember I'd find a moment to turn and blink to water my contact. It's just like
Oh.
life-changing.
Relubricate your
Yeah,
eye.
relubricate.
Yeah. You talk about accessibility. I just want to know, ballpark, how much does cataract surgery cost?
Well, you can go from what the insurance covers. So if you have insurance, then your insurance can cover it if you get what we call a basic lens. That's a best fit. If you have astigmatism like you wouldn't want to do that because it wouldn't correct your vision. So my philosophy is if you can afford it, which can be some thousands of dollars per eye, because there's lenses that cost us a lot of money to purchase. We like to do it with laser. So we use laser, not LASIK, but laser.
Right,
Different
sure.
laser. We have lots of different
Right.
lasers. So you have costs that are built into that. So it can be thousands of dollars per eye.
Can people finance this if they
Yes,
don't have?
they can finance
With
it. We even
CareCredit?
CareCredit.
Yes,
Yes.
okay.
That's what we use at
Oh, great.
Envision. We use CareCredit. So believe it or not, we even have a new lens. So we have lenses that can allow you to see up close and far away, because once you take the lens out, you can't accommodate anymore. So you have to restore the near vision in it.
Oh, okay.
In the lens.
Like the bifocal.
Yeah.
thing.
So we have a trifocal that gives you here, here, and far away.
So you wouldn't need bifocals?
No.
Wow.
Most of my patients, when I do it, don't need glasses
Ever.
anymore.
Dr. Rowen, can I be a patient? Like,
I
I'm not
know.
even kidding
Yes,
you right
you
now,
can.
seriously,
Of
because
course.
I never even heard of a lot of what, I mean, you're really schooling us right now.
That's
to the
great.
point where I'm like, wait, I thought for the rest of my life I was going to have to wear contact
No, you
lenses. I really, but I thought
I
that.
could get you out of these in a few weeks. if you
Okay,
come in and
make
we
an
get the right
appointment.
Where
measure.
is your appointment book?
seriously.
I'm not even kidding
you're
you.
gonna
Like,
never
that
see
is
we'll set that up.
life-changing.
Life changing.
It is incredible.
And it's so
she
easy.
can tell you how
Yeah.
life changing it is.
I've heard friends who've had LASIK, but again,
Mm-hmm.
I've always been told you're not, that's not for you. And I didn't think of the possibility of other options for correcting
Right.
my vision in a more permanent way.
Yeah.
Yeah, that's
I
so
didn't even
cool.
Well, the
consider it, and I didn't
ICL
ask
would take you
questions.
until you got cataracts,
Right.
and then you just do the cataract.
And then you do the cataract. Now, question: if you had LASIK, like me, could you do that surgery to help correct your bifocal, so you don't have
so
to wear
that so let's
bifocals?
go into that, because I was
Okay.
going to talk about some of the new
Yeah,
technologies that
I want
we
to go
have.
back to my eyes. I'm just kidding.
I
Yeah.
want to hear her.
So you don't need to do it yet,
Okay.
obviously. But we get a lot of patients who've had LASIK and now can't see up close, and they're
Right.
feeling like, well, I see okay in the distance, I can't see up close, or my vision is changing because that lens is changing.
Yes.
So if the laser ablation was okay, we have a lot of things we can offer. My favorite thing of which is something new called the light adjustable lens.
Oh, what's that?
Imagine this.
Tell us.
We put the lens in the eye, no matter what your prescription was or what you had, and then we shine light on it from 3 to 5 times. You just come back to the office and we shine a light after we determine your prescription. It actually changes the prescription of the lens while it's in the eye
What?
to what you need.
And then you're healed?
You're done.
Technology is so, in my California voice, rad.
It's so rad.
It's
well,
so rad.
I remember being in my LASIK appointment and the doctor saying, I had it done over 10 years, I mean, at least I think 15 years ago.
Oh,
now.
wow.
Yeah. And he said, by the time you need bifocals, don't worry, we'll have something to correct that. So now we do.
Now we
This
do.
is
Look at
amazing.
that.
You do. We
so
can
happy.
correct it.
That's now. What about with LASIK? I've heard a rumor that if you got it too young, quote unquote, is this a thing that you have to do it twice? My husband actually had to do it twice, and they said it was because he got it too young.
Well,
That was
your
a long time
husband,
ago now.
you said was 24.
He's 43, and yeah, he was
24 when he had it.
when he got it.
We don't really consider 24 too young.
Okay, not anymore. Or
No,
was
not
that
anymore.
ever a thing?
So I think 20 years ago, we had different lasers.
Okay, I see.
We have excellent lasers today. So the patterns are more consistent with more permanent changes.
Okay.
Now, that's if he's nearsighted. If he's farsighted, sometimes those effects do wear off and you might need it again.
Yes.
And that's where the people that are coming in their 50s and 60s are called a lot of them are farsighted, where they lose the ability to see up close and far away.
I
So
see.
that,
Okay.
or highly nearsighted like you, and we just will fix it. The ICL is amazing for you.
So let's talk about cataract recovery, cataract surgery recovery. You talked about how cataract surgery itself is not a super long process.
Yeah.
But what does the timeline for recovery look like?
And is it painful?
It's not painful.
Okay, all right.
Pain is abnormal. If you have pain, you need to come back to the doctor.
Okay.
Okay, that's good to know.
Yeah.
That's a red
So
flag. Yeah.
you could have irritation, like a scratchy sensation or something. That's not what I'm talking about. Actual
Okay.
pain would be abnormal.
Okay. Good to know.
That could be an inflammation issue. It's rare to get an infection, but infection also very rare today. But we always have to say that. So if you have pain, you don't ignore that.
Call the doctor.
Call it up.
Yeah, get in.
Okay.
So no pain. The recovery is immediate. We call it instant vision cataract
So
surgery. The first few days could be blurry because you have some energy in the eye. So the cornea, the outside layer, can get a little swollen. So we have to wait for that to calm down. You still see, but it could be a little blurry. And we don't want you to go underwater for 2 weeks.
Oh, okay.
2 weeks underwater, no underwater.
But you could shower. or
You can
something.
shower.
Okay,
Right.
yeah.
We tell you to try to limit your activities a little bit. You know, they'll tell you not to bend and lift, so we don't want you lifting heavy weights or doing too much while it settles into place.
Okay.
What about driving?
Driving's fine.
Oh,
Well,
wow.
Yeah, most of our patients drive the next day to our office
But-
for their post-op.
But to the appointment, you would because you did mention that they are under like a twilight anesthesia.
They don't
so
drive
someone,
the day of the surgery.
Okay, so someone
Yeah,
has to be with
somebody
you to
has to
bring
be
you to
with
the
them.
appointment and then
That's
be
right.
with you to take you home.
Yeah, we don't ever let you drive if you've had anesthesia
Of course not.
or sedation.
Yeah, yeah.
Right.
Okay, because that's not safe.
Yeah.
But the next day, and it wears off really quick. So like
Okay.
that afternoon, we still tell you not to drive during the day.
That makes sense.
Okay.
Okay.
And you're dilated. So that day it's a little blurry.
For sure.
Next day you're better, and some people see immediately, and some people take a few more days to heal, depending on how long did they wait to get that cataract done.
All right. I'm gonna
If
tell
that
my-
cataract was like, hard like this, they're going to have a longer recovery because the cornea can get swollen.
Do you send people home with those giant sunglasses?
They're not
that
as
they-
giant anymore.
Oh, they're not. Oh, okay.
They're not.
and you can
okay.
wear your own.
Oh, okay.
We're like, oh. And then you follow up with you, obviously.
Yes.
And
What does that
monitor.
follow-up
Yeah. What does
period?
it look
Yeah.
like?
Well, we see you at a day,
Okay.
a week, and a month.
All right. So
If
it's
you
nothing
were
to be afraid
referred, it's nothing to be
of. I
afraid
feel like
of.
this person in my life, who shall remain nameless, is very
Who knows who
afraid.
they are because we
Because-
keep referring to them, but go on.
So when
Exactly.
you watch this program,
So when he
Yeah,
watches,
if you're
he's
watching
gonna
this
know.
episode, you're listening.
it's you.
Talking about you.
I mean, oops.
Oops.
But he needs to know that it is
Yeah.
not something to be afraid of. It's a
Yeah.
very simple,
No,
right?
It's not.
From what I
it's really
understand.
not to be afraid of. In fact, most people who come in who are nervous, I say, let's talk at the end of the case and tell me, was there anything to be nervous about? And they all say no.
Okay. I just remember in the LASIK surgery, I don't know if it's changed since when I did, but you're right. I couldn't even see
You can't see
him.
what we're doing.
Yeah. So it just felt like I was just lying there. Not
Uh,
like the
You
dentist where
see
you
pretty
can see.
colors sometimes.
Yeah.
Oh,
That
what,
you can see.
Yeah.
what about eye drops? Are you sending people home with eye drops?
yeah, they
the
take some eye
Is that
drops.
a part of the
Yeah, that's
aftercare
part of it.
process? Okay. Okay. It's a prescription eye drop, I'm
Yeah.
assuming. Okay.
So now we have one of our favorite segments. It's called Ask
Yes.
the Expert, which is you,
Obviously.
Dr. Rowen, obviously.
The OG.
We get questions from our audience,
Mm-hmm.
our listeners, viewers. So we're gonna read those and have
Oh.
you answer them.
I get to start. I want to start with this
You
one.
please,
May I?
yes.
Okay. Can you walk us through what happens during a typical cataract surgery procedure?
Sure. You come to it's usually done in an outpatient surgery center. That's typical
Okay.
today for cataracts. And you get dropped by the nurses. They do an intake, make sure you're medically okay. We like to know if there's any medical issues in advance also. And so we work you up. It can take a certain amount of time just to get dilated and get all of that done. You're laying in a little bed that wheels. You get your drops while you're in that bed. You wear your street clothes.
Easy.
Don't have to change anything.
Don't have to be in a gown.
Nope.
Nope.
Open to the front.
Yeah. No, thank
None
you.
of that. You
No,
don't even
thank you.
change. You get on the
Thank
bed
you.
with your clothes on.
Wow.
We wheel you in to and we'll put a small little IV port in.
Oh,
Just in
okay.
case.
Okay.
Yeah, well that's what we deliver the IV sedation.
Oh, right.
Oh,
Okay. Yeah.
okay. Yeah.
And then you go into the room, you get a little IV, you're like in nice la la land.
Yeah.
And,
Dreamville.
yeah, you're happy and you don't either remember it or you sleep and you kind of don't remember any of this. We do we
Amazing.
do a laser to get in there and it does a lot of our steps, or we have to do it manually if somebody doesn't elect to do that because of finances. Usually it's because of finances,
okay.
because that's extra, because the insurance doesn't cover laser. And then patient is looking at a white light, sort of like the lights that are here. You look straight in it. I tell you to just keep your eyes still. I do my little job.
Wait, but do you do the I don't know what it's called, obviously, the thing that they pry your eye open with so that it remains
Oh, there's
open?
a speculum. Yeah,
Oh,
it's
it's
called a
not-
speculum.
Oh, okay.
Yeah, but you don't even know it's in there.
Oh, wow.
Because you're numb.
Oh.
The drops numb up everything. You don't even know we
Oh,
put
that's
it
so
in.
cool.
We drape it, so you're covered with a little plastic, but again, you're just there, laying there, you're looking at some lights. And then it's sort of, if you're awake enough, it looks like you're looking up from underwater. It's really
Oh,
cool,
yeah.
actually. So
I
people
feel
tell
like
you.
I remember that now that you mention it with
Yeah.
LASIK anyway.
So like yeah, you kind of see some lights and you kind of see something happening,
Blurry almost.
but you never see hands come in.
Never.
You
I'm
never see
totally
instruments. You
Laser,
see
instrument.
nothing.
You don't see anything. That way.
Nothing.
Have you had the surgery yourself?
I had cataract surgery. I had it
Really?
young. Yeah.
Wow. How old were you?
I can't say.
Oh, she won't share that. Okay,
I
ask.
don't
Okay,
share
so
That's fine. That's
another
fine.
question we had is my doctor is recommending doing both eyes at the same time. Is there a benefit to doing them at the same time versus separately? Very good question.
Well, that's a very good question.
Yeah.
It's hard sometimes to get insurance to cover it at the same time.
Really?
Some we
You would think it would.
you know, there are certain, like Kaiser Permanente does a lot of them bilaterally, and they've presented data that it's pretty safe to do it, but most of us don't.
Oh, okay.
Most of us might wait a certain number of days or a week or two to do the second.
Okay.
Because I offer so many specialty lenses, I like to see how the patient does with
Oh.
that lens.
Okay.
Do they like it? Do they see? Did I get what I wanted? Did they get what they wanted out of it? And how might I need to adjust the next eye to compensate for what they didn't
Right.
get? So that's why
sense.
we stagger them a little bit.
Oh, that makes sense.
I have one more question.
Yes.
And it is, what are the early onset signs of cataracts?
Okay. Well, we talked about that. So blurry vision, hazy vision, halos, starbursts around lights, hard to drive at night, can't see street signs, can't see the TV clearly, the numbers, start to lose detail, hard to read, focusing, computer work, reading, all of that. It's blurry vision or hazy or lights. Light, it's really interesting because the lights affect you. So they can cause this starbursting. And our new car lights almost have starbursts just coming out of them anyway.
Oh, weird.
They do.
Wow.
And so when you have cataracts, it just
Yeah,
magnifies them.
yeah. Oh, that must
So-
be super annoying.
It can
for
be
people.
very annoying for
Yeah.
people.
Dr. Rowen, is there anything we didn't ask you about cataracts specifically that you'd like to share, or anything you want to take away, like a stigma that it's so scary, we can't do this, but is there anything you'd like to
Well, I
share
mean,
about?
I think we talked about the fact that you shouldn't be scared of it. It's better to come in early. The misnomer is keep waiting and waiting. I'm too afraid to do it. I have so many patients that come in and they've been so afraid. I had 3 of them yesterday. I did 20 yesterday.
20?
Of course you did.
Yeah.
It took
So-
you 20 minutes. I'm
No.
just kidding.
No,
Yeah.
it was a full day.
Right.
But they came in and their cataracts were the color of this,
Oh.
or the color of your pants, or darker.
That's
color
bad.
of this.
Yeah. Oh,
And yeah,
Ugh.
and when they waited, it actually can scar a little bit to that capsule.
oh.
So I couldn't clean it all off safely. So I said I'm going to have to do that other secondary cataract laser on you probably in a month. So we don't want them to wait. We don't want you to be afraid to come in. Come in early. Sometimes they wait so long we can't even get the right measurements.
Oh, God.
Uh-huh. So come in early as soon as you start seeing vision changes. And, if you go to your optometrist, if he says, well, you have early cataracts, I'm going to change your glasses. He or she says, I'm going to change your glasses. Well, can I maybe go and check out if they're close to being ready? If you're still 20/20 and you're not having problems, we don't tell you to jump into doing it.
Okay.
But even 20/30 and 20/40 vision can affect patients. I've had patients who are measuring 20/20 in the room that can't see outside
wow.
because the lights are coming in
Oh,
from outside.
Sure.
So what we see in the exam room isn't always what you see outside. So we might be able to get you to 20/20 and they'll come back to the doctor and say, these glasses aren't working. It's because the cataract's
Yeah.
getting worse. So we say, come in, get it evaluated. We have such good technology today. Maybe 20 years ago, we didn't have this technology, the lens
Right.
technology that we do, the lenses and the lasers. So we really would prefer not to wait too late. As soon as
cool.
it is affecting those activities of daily living, then we'd like to see you.
Yeah.
We'd like to get you measured and take a look. And then I've had patients that have come in, have been referred, and they say, I really am fine. I measure them fine. I see an early cataract. I go, all right, I'm going to let you out of here, but I do want to see you back 6 months to a year.
Okay.
So I don't say, go off. I said,
No.
because if it progresses, again, I want to see it. And sometimes they go really fast, like 3 months.
Oh, wow.
So somebody might notice it, and then all of a sudden, like my guy yesterday, I mean, he was young, he was 50, and he had a little opaque white center in the cataract. Couldn't even see through the center anymore. And he said it happened since January.
Wow.
That's
So
so
rapid
quick.
progression.
It can be very
Wow.
rapid as well. So just don't be afraid.
Yeah.
Don't
I-
let fear
don't be
keep you from coming in there and taking care of your eyes.
Yeah,
That's
so
exactly
important.
right.
Your eye health is so important. Dr. Rowen, thank you so much for joining us
so
today.
much. This
Well,
was
Great to have you
wonderful.
as our expert.
Yes,
you.
Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.